Hello and welcome. Today we're diving deep into a serious eye condition, the corneal ulcer. What is it? Why does it happen? And what can we do about it? Let's get started. Corneal ulcers aren't spontaneous, they have causes. The most common culprit is bacterial infection, often linked to improper contact lens use. But that's not the only player. Viral infections, like herpes simplex, can also lead to ulcers. Fungal infections, although less frequent, can occur, especially after eye injuries involving plant matter. Parasitic infections, specifically acanthamoeba, pose a risk, particularly for contact lens wearers using contaminated water. Even dry eye and eyelid disorders can weaken the cornea, making it vulnerable to ulceration. Trauma, like a scratch or foreign object, can break the corneal surface, providing an entry point for infection. And in rare cases, autoimmune diseases can contribute to corneal ulcers. So, how does a corneal ulcer actually develop? Imagine the cornea, the clear front of your eye, as a protective shield. When this shield is breached, say by bacteria, the body kicks into defense mode. White blood cells rush to the scene, releasing enzymes to fight the infection. While these enzymes target the invaders, they can also damage the surrounding corneal tissue. This tissue breakdown leads to erosion of the corneal surface, forming the ulcer. The inflammation also causes pain, redness, and blurred vision. Corneal ulcers affect people worldwide, but certain factors increase the risk. Contact lens wear is a significant one, especially with extended wear or poor hygiene. Geographical location plays a role. Warmer climates and areas with less access to clean water see higher rates of acanthamoeba infections. Occupations involving potential eye trauma, like construction or farming, also elevate the risk. Pre-existing eye conditions, such as dry eye or blepharitis, create a less resilient corneal surface, and weakened immune systems due to conditions like diabetes or HIV can make individuals more susceptible to infection. The signs and symptoms of a corneal ulcer are often quite noticeable. You'll likely experience intense eye pain, often described as a burning or gritty sensation. Redness of the eye is common, as is excessive tearing. Blurred vision or decreased vision acuity will likely occur. Sensitivity to light, known as photophobia, can be quite pronounced. You may also notice a white or gray spot on the cornea, which is the ulcer itself. Some individuals may also experience eyelid swelling or discharge from the eye. Diagnosing a corneal ulcer requires a thorough eye examination by an eye care professional. This typically involves checking your vision and examining the eye with a slit lamp, a special microscope that allows a detailed view of the cornea. The doctor may use fluorescein staining, where a dye is applied to the eye to highlight the ulcer. To identify the specific cause of the ulcer, a corneal scraping may be taken and sent to a lab for analysis. This helps determine whether the ulcer is caused by bacteria, virus, fungus, or parasite, guiding the appropriate treatment. While the underlying principle of a corneal ulcer remains the same, the causes dictate sub-categorization for treatment purposes. Bacterial ulcers often present with rapid onset and are more aggressive. Viral ulcers, like those caused by herpes simplex, may present with a distinct branching pattern. Fungal ulcers are often indolent and slower to develop. Acanthamoeba ulcers are particularly painful and difficult to treat. Identifying the type of ulcer is crucial for effective treatment. Treatment for corneal ulcers depends on the underlying cause. Bacterial ulcers typically require antibiotic eye drops, administered frequently throughout the day. Antiviral medications, either topical or oral, are used for viral ulcers. Antifungal medications, which can be topical or oral, are needed for fungal ulcers. Acanthamoeba infections are treated with a combination of anti-parasitic eye drops. In severe cases, oral medications or even surgery, such as a corneal transplant, may be necessary. It's crucial to avoid wearing contact lenses during treatment. Pain management is also important and can be achieved with oral pain relievers. Preventing corneal ulcers involves a multifaceted approach. For contact lens wearers, meticulous hygiene is paramount. Always wash your hands thoroughly before handling lenses. Clean and disinfect lenses according to the manufacturer's instructions. Never use tap water to rinse lenses or store them. Avoid wearing lenses overnight unless specifically prescribed by your doctor. Protect your eyes from trauma by wearing safety glasses in hazardous environments. Seek prompt medical attention for any eye injuries or infections. If you have dry eye, manage it effectively with artificial tears or other treatments. And if you experience any symptoms of a corneal ulcer, see an eye doctor immediately. The prognosis for corneal ulcers depends on several factors, including the size and location of the ulcer, the underlying cause, and the timeliness of treatment. With prompt and appropriate treatment, many corneal ulcers heal completely. However, some can lead to scarring, which can affect vision. In severe cases, corneal perforation and vision loss can occur. Recent research focuses on developing new and more effective antimicrobial agents, as well as improved techniques for corneal transplantation. Studies are also exploring the use of stem cells to regenerate damaged corneal tissue, offering hope for improved outcomes in the future. Thank you for watching.